Um, Dr. Anita is not able to join. I don't understand how. So you're able to see the presentation?
Yes. Just a second. So you can have the slideshow also.
Okay. Yeah.
Yes. So
I guess Dr. Madhu and Anita are not able to join. They're saying the GM of Dabur is there another session going on or something?
no. I think now they can see. They want to see or what?
I think they're going to be part of the program
So now
because
it started. If they are clicking on the website, they are here now as well.
yeah, she's here. Yeah, there she is.
Actually, the link which I have shared with you was there
Okay,
for
no,
them as well.
I forwarded the link to them. I forwarded the link to.
Yeah, welcome all. We have like right now 100 live people who are just watching us. So let's start now. And Dr. Jammi, you can have your slideshow also. You can just click on the slideshow as well.
Yeah, I will.
So welcome, good evening, all of you. Thank you so much for joining us again. And we are very much pleased to have the team from Jammi Pharmaceuticals with us. And first time they will be discussing and they will be revealing certain treatment protocols on an online platform. Correct me if I'm wrong, Dr. Jammi. I think this will be first time we'll be revealing certain treatment protocols. So आप सबका स्वागत है.
Yes.
We welcome all of you. पहली बार Jammi Pharmaceutical will be discussing about their treatment protocols related to COVID, how they are managing in their clinics, what are the various maybe challenges, certain tips they can share with us. So I welcome again Dr. Narsimham Jammi and Dr. Anita Balachandran from Jammi Pharmaceutical. Thank you so much for joining us today. Uh, Hope all of you are now aware. Actually, the context of doing this event right now is again we are seeing a surge in the cases here in Delhi NCR. In Delhi specifically, things are very bad, and all the hospitals are now on an exhaustive limit. They don't have any beds in ICU. I don't know about that much of South. Maybe Dr. Jammi will have some more idea and he will share with us what exactly is the situation right now. But overall, we are seeing that in the entire nation, now there is again a peak. And in many states and many cities, we are seeing lots of cases again. So we request all of you to have some focus today because these people are dealing and I think they have handled a lot. So they will be sharing certain aspects with us. तो आप सब लोग इसको फोकस के साथ ट्रीटमेंट को इस सेशन को अटेंड करें बिकॉज दिस विल बी अ वेरी क्रूशियल एंड इम्पॉर्टेंट सेशन फॉर ऑल ऑफ अस टू टेक इट फॉरवर्ड फ्रॉम हियर एंड वन स्पेसिफिक पॉइंट मैं आप सबसे यहाँ शेयर करना चाह रहा हूँ एंड दिस लाइक वी कीप ऑन गेटिंग ऑन रेगुलर बेसिस सो वन medicine I will say from Jammi we are also using in many COVID cases in our protocol. In fact, two specifically. Mr. Jammi, Dr. Jammi will have some more detailed information for all of you. But one specifically I want to mention, I will request, I don't know if he has included that detailed aspects in his presentation or not, but I will request him to have some elaborative discussion on that particular medicine which I am using. I also want to know more on that. That is Pyrrole DS. So Pyrrole
Yes.
DS using and
We're
it's an
talking about it.
excellent medicine, excellent antipyretic. I don't know, it is working very good in terms of being an antiviral as well because we have seen reports are when we added this to our standard of care, we have seen those who were getting healed in couple of weeks are getting within week as well. So it's acting as a catalyst and it's a very important medicine in our management right now as far as COVID cases are concerned. So I would like to request Dr. Jammi now to take it forward with all of you. And thank you so much again. We know it's 8:30. Still, I can see so many people are attending this session, and these sessions will be available on our social media, YouTube channel, as well as on Facebook later on as well. So you can refer to your friends, seniors, and juniors as well to watch it later on. And you can always ask your questions during the presentation also. अगर आपके मन में कोई query है, कोई question है, you can just post in a comment box. After the discussion, after the presentation, we will take your questions with the panel, and we will try to resolve that with them. Thank you so much again for joining us today, and I will hand over the session to Dr. Jammi.
Absolutely. Thank you, Dr. Piyush. So it's a great pleasure for me to be here. Now, there are two things that are very important aspects of COVID over here. Now, we are sharing our entire protocol with you. This is in the interest of all the people of India, making sure that we are open, transparent about how to help people. Two things have come to light in the last several months of COVID. The most important aspect of this whole issue is that COVID is something that is a very complicated disease. And before we get to the disease aspects of things, it's very important that we get a little bit of a background on what the concept of wellness is. And wellness is not just merely the absence of disease. No, it is an active process based on the choices and decision you, me, we all make together. So wellness is not just merely living per se, it is actually thriving. And thriving in a situation, an environment where the odds are stacked heavily against you. Exactly the case of COVID right now, where people seem to be falling sick left, right, and center, where they don't need to fall sick. But even if they do fall sick, this is not the end of the world, and that's something that I want to tell people. I want you to understand a couple of things about COVID. Is that we have always been in the healthcare space. We have several verticals, like I'm telling you, therapeutics, wellness and immunity, obesity, sexual wellness in men and women, skin care, and lifestyle diseases. But specifically, the target of this evening's talk is about COVID. COVID-19 is a disease that's caused by a virus called novel coronavirus 19, or nCoV-19. It's a very complicated disease. Now, it has different presentations in various populations. For example, there are several symptoms, and I'm just going to run through the most common ones of them. Please understand and appreciate that these are not the only symptoms, but these are the most commonly encountered symptoms that have been presented in various patients across the globe per se. Fever. Now, there's a typically high fever between 102 to 103 degrees Fahrenheit, even more sometimes, 104 also. Cough. The next one is cough, a dry and persistent and a heavy cough. Basically, it keeps happening. It doesn't stop. It's a continuous cough that happens, and so much so that your intercostal muscles start hurting. So that is the extent of which this cough happens. It's a very nasty cough. Weakness. You feel debilitated. Okay, and in some patients you also have joint pains. And then there is lack of appetite. There is a heaviness in the stomach, obviously, because you're not eating properly, and there's a lot of gas formation. And in severe cases, you end up having a cytokine storm that leads to a lot of pulmonological events and cardiac events as well. Now, these are all the most commonly encountered symptoms and presentations of the COVID-19. Now, what you have to remember is COVID is something that you can deal with. We have a standard COVID treatment protocol in Jammi's clinic, and the standard of care. I'm going to compare our methodology with the standard allopathic care. Standard of care in allopathy has literally 9 to 11 different medicines, depending upon the doctor you go to and depending on the hospital that you go to. And these are for mild and moderate cases. Obviously, in severe cases, you're on the ventilator, and there is a very, very different treatment modality. You end up getting remdesivir and other medicines that are given intravenously. We're talking about mild to moderate cases, which 95% of the population ends up getting. Okay, and Jammis has supplied more than 75,000 Kada packets. These Kada packets are known as Kabasura Kudineer packets during the last 6 months, and we have treated in our own clinic COVID cases with varying symptoms and severity. All of them have fully recovered within 7 to 15 days. Severe cases also have come to us with very strong symptoms. They have recovered in less than 15 days, and mild to moderate, within 7 days, they are able to recover completely. Our treatment modality is very conservative and affordable. These are two important things that we need to keep in mind, because if you go to the corporate hospitals of the world, you end up spending lakhs and lakhs of rupees. Whereas depending upon the symptoms presented, the cost of the entire treatment regimen in Jammi's clinic using Jammi's methodology can range anywhere from 2,000 to 4,000 rupees for that 15-day time period. So this is something that we all have to keep in mind, because does not distinguish between rich and poor, from city dwellers to rural dwellers. Everybody, COVID seems to affect everybody. And the key is in being able to recover quickly. And how do we go about doing that is what we need to talk about. Now, COVID is something that you need to be careful about, not fearful about. Please remember that fear is not something that is going to get you anywhere, right? So initially, a lot of patients who come to us with a presentation of fever. That is the first symptoms that most people seem to get. Cough usually ends up being secondary, at least the patients we have encountered. It can go vice versa as well. You can even end up having tastelessness and a lack of smell. The order in which these symptoms happen varies from person to person, but in general, what we have seen in our clinic is that they come to us presented with a fever. We tell them to get a COVID test. Many people don't want to get it, so we just treat them anyway, simply because they're worried about being quarantined. And we tell them, even whether they are not sure whether it's COVID or not COVID, they still need to quarantine. And if they are sure that it's COVID because of the lab test, the RT-PCR test that's being done, then it's mandatory that they get quarantined so that they protect their family members around them. So the first thing that we give is the Kabasara Kudineer Khada. Now this khada is something that is got 15 different ingredients. There are very strong antiviral ingredients. It's got antipyretic ingredients. And basically what you do is you take 1 teaspoon of this khada and you boil it in water, make that water into 1/4 its starting quantity. So per person, you need to use 1 teaspoon. So you take 1 glass of water, 1 teaspoon of this khada churna that is there, add it, boil it, bring it down to 1/4. And you consume it as soon as it cools down, so that it's palatable. Now, for a patient who has got COVID-19, this is to be taken 2 times a day. For caregivers and family members who live in the same house, the same thing needs to be taken 1 time a day. Along with this, what we give Sudarshana Churna. We give it in the form of capsules. The dosage recommended for Sudarshana Churna is 3 to 4 grams a day. Now, in people who have high fevers, what we do is we tell them to take 2 capsules 4 times a day or 3 times a day, depending upon the fever, so that they're able to fight the actual viral disease. Sudarshana Churna, as you all know, is the Ramban for any disease that has fever as one of its symptoms. It has got antipyretic capabilities. It's anti-inflammatory in nature. It's an analgesic. So this is where the pains come down. It also has anti-allergic properties. It has got antiviral, antibacterial properties. It also has cardioprotective and immunomodulatory properties. And some of the ingredients, this Sudarshana Churna, as you know, has nearly 47 different ingredients, with the most important ingredient being Kalmeg. Now, all of these ingredients come together to form this amazing concoction, which has an antioxidant activity, anti-asthmatic activity as well, and also has some digestive effects to make sure that you don't have this heaviness, this bloated feeling, and so on and so forth. It also has anti-tussive activities for people who end up getting that cough and phlegm. Along with this fever, what we give is a preparation called Pyral DS. Now, Pyral DS is an amazing medicine. The main component of Pyral DS is Hutasini Rasa. Now, Hutasini Rasa is a Kajali preparation. It is very difficult to make. It takes a long time. It takes nearly 2 weeks to make Pyral DS, but the efficacy is beyond compare. It has got antiviral properties. It has got Varatika Basma in it, and it's very useful in the treatment of gastritis. Varatika Basma, also in duodenitis. Along with it, it has got Shanka Basma in it. Shanka Basma is useful for abdominal pain, malabsorption. Please remember, when you have COVID, you're not really able to eat properly. So whatever little you eat, you need to be able to absorb it. So the Shanka Basma is very useful in this malabsorption situation. So you make sure that you absorb your nutrients properly. It's got black pepper. Obviously, black pepper is very important. It has antioxidant and antibacterial activities. Now, this antibacterial property is important in case there is a secondary infection. Ginger, very important. Ginger is there even in Kabasura Kudineer. Now, ginger improves the lack of taste and lack of smell. That's one of the very important aspects of ginger, along with the fact that it's it aids in immune system, promotes the immune system. It's an immunomodulator, and also it aids in healthy sweating. That's something that you need to understand, that when you have a fever, you need to bring it down. It aids in healthy sweating during fevers and flu. So that's why ginger is very important, and both Pyral DS and Kabasura Kudineer contains shunti. It contains obviously it contains Bringraj. It has, which is antiviral and anti-inflammatory. It's an excellent detoxifier as well. Another important, very important aspect that really helps, in our opinion, that seems to get rid of the virus very quickly from the body, is the fact that it's got something called Karadupam. Karadupam is nothing but burnt coconut shells, and there's a very unique way of processing it. This has been handed down to us from generation to generation. I learned from my father, who learned from his father, who learned from his father. So it has come down to us in a parampara fashion. So the way in which we process the Karadupam is very important. Now, Karadupam is an adsorbent. Basically, what it does is it's a universal detoxifier. It absorbs toxins, viruses, and other impurities in the body. Lemon juice is another important aspect of Pyral DS. If you actually put Pyral DS in your mouth, you'll find that it's got a very nice lemony taste to it. Lemon obviously has got antimicrobial properties. So this is the initial stage of any patient that comes to us. We give them these three medicines. Okay, so Kabasura Kudineer Kada. So the patient, if he has COVID, has to take Kada 2 times a day. The family members have to take 1 time a day, and the patient has to take, along with the Kada, Sudarshana Churna capsules 3 or 4 times a day, depending upon the severity of the fever, and Pyral DS 2 tablets 3 times a day. If he's a very heavy person, obese, more than 90 kilos, he has to take 3 tablets 3 times a day. So again, weight-based. I will share the details of this treatment modality at the end of this discussion to Indian Vaidyas, and he may circulate it. We want to share it. We want to give it to as many people as possible, so that people are getting better faster and quicker. Now, the next step of this disease presentation is cough. Invariably, within 2 to 3 days, people end up getting a cough. So they usually have fever and a cough. So along with these 3 medicines, what we do is we give a combination of AA caps and Swascolin syrup. Now, AA caps is a very, very useful antispasmodic. It also has excellent anti-tussive properties. It actually has Talisadi Churna in it. So does Swascolin. Swascolin is made with Swasananda Rasa. Now, it is very important that again, there are very few companies making Swasananda Rasa the way it ought to be made. We know that Swasananda Rasa is not just meant for respiratory problems. It also actually boosts immunity. Now, this is very important. We need to keep this in mind, because along with the fact that you have fever and cough, their immunity has come down. And the combination of AA caps. So basically what we tell people is, you take AA caps, you take the capsules, open the capsules, pour the contents of the capsules into a big spoon, and add 1 capful of Swascolin, which is about 10 ml of Swascolin. Add it to it, mix it nicely, and then consume it. Okay, so this again is weight-based. Anybody over 60 kilos, we tell you need to take 2 AA capsules for each dose, along with 10 ml of Swascolin. This has a very soothing effect on the throat, because you're already coughing a lot, your throat has become hoarse, and these 2 combination of AA caps and Swascolin leads to a very quick relief of the cough and cold, typically without any of these Ayurvedic interventions. We see that this cough lasts as long as even 15 days. Whereas with these things, the cough comes down very rapidly. Maybe in about 3 to 4 days, you start seeing a rapid improvement. In some cases, we've seen it even in 2 days. So again, this is not the something that we need to take lightly. Like I keep telling you, we need to be careful about COVID. We need to not be fearful. Fear is different from care. Let us not be fearful of COVID. Let us be careful of COVID. Now, the next step in this whole process is when you have fever, cough, pain, lack of appetite. So this is when you're the 4th. So people come to us at various stages. So people who immediately suspect that they have COVID, they come to us on day 1, and then their treatment modality becomes very easy, because they don't progress to the next stage. Some of us come to us in the 5th or 6th day, when they have the fever and the cough. Some of them come to us even after trying out Dolo 650 and antibiotics and Zincovet, everything. They've tried everything, and then they come to us on day 7, day 8. That's when we have to give them this is the entire range of medicines that we give people. So basically, there are 6 different products as opposed to 11. So this is when it's an advanced stage. What we give them is the Khada, the Pyral DS tablets, Sudarshana Churna capsules, A caps and Swasthol combination, and we give them granules called Immunzen granules. Now, Immunzen granules is so important for modulating immunity, and I'll tell you why it is so important. It is made of 19 different herbs. Okay, and the most important aspect of these herbs is that we don't add any artificial or synthetic sources of nutrient or vitamins to them. All of these things, all of the things that are required for a proper immune system function is found in the herbs. Now, I'm going to pick out about 8 different herbs that are found in Immunzen. I'm going to talk to you about the different kind of minerals and nutrients that are there in it. And this is why this particular treatment regimen is so effective, because you do need vitamin C, you do need zinc, you do need selenium, you do need magnesium, you do need manganese, and all of these things are found in very abundant quantities in the individual ingredients of Immunzen. For example, we have ashwagandha in it. Ashwagandha is a natural source of zinc, calcium, potassium, magnesium. Okay, these are the 4 things that are found in ashwagandha. Next, shunti. Shunti is a natural source of zinc, calcium, magnesium, phosphorus, iron, copper, manganese, and selenium. Okay, dalchini, zinc, calcium, potassium. Okay, lavanga patra, zinc, calcium, and potassium. Chitraka. Now, Chitraka is excellent for coughs. As a matter of fact, in South India, what we do is when little babies, little infants, when they actually have a cough, they end up getting a cough because of the cold weather or something, we actually take a stone and we take Chitraka, we take the rhizome of Chitraka and we rub it and we take it, mix it with honey and give it to them. And the cough or cold gets relieved in a matter of 2 or 3 doses. So Chitraka is very, very useful. And that's an excellent source of micronutrients. It has got zinc, calcium, potassium, magnesium, phosphorus, chromium, cobalt, manganese, selenium. All of these are there in minute quantities. These are all things that are very, very important in making sure that your immune system functions properly. Then we have people or ashwata. That is a natural source of zinc, calcium, potassium, iron, chromium, and copper, and selenium. Ajwain, it's got ajwain in it. Again, ajwain's got manganese and copper along with iron and zinc. Saffron. Now, saffron is excellent for not only the heart but also in stimulating blood flow across various organs of the body. Now, that has got the entire range of micronutrients that I just described: selenium, manganese, copper, iron, phosphorus, magnesium, potassium, zinc, and calcium. Okay, and dhanyaka. Dhanyaka again is a very rich source of selenium, phosphorus, calcium, and zinc. So now this Immunzen is something that we tell people to take during the treatment regimen and continue taking forever, because this is something we need to be aware of the fact that we are in a situation where we have no prediction of when the pandemic is going to end. We don't know how how the vaccine is going to turn out. We have no idea whether the vaccine is going to be effective for the Indian population. This is something else I will tell you from my background as a molecular biologist and as a molecular pharmacologist. We need to make sure that when we get the vaccine is against the Indian strains found in India that are local to India. There is no point in taking vaccines that are not indigenous to India and that are found somewhere else in other parts of the globe. Then it makes no sense to be taking that vaccine, because vaccines are very specific in their nature and they're intended to be very specific. So this is the basic treatment modality that we have. And as a summary, because we have very limited time, because I want to open up the floor for questions. COVID is not something you should fear. You need to be careful but not fearful. Ayurveda, especially the way we've gone around researching it and we've treated it. And I'm sure all of you doctors have your own treatment modalities. Ayurveda has got excellent treatments for COVID. Various Vaidyas, like I said, have their own protocols for treating COVID-19. We have gone through a protocol for treatment in this particular talk over here. It's a combination of 3 classical products: Sudarshana Churna capsules, Kabasara Kodinir, and Pyral. Pyral is nothing but Hutasini Rasa along with lemon and Karadupa, and we have 3 proprietary products: the Immunes and Granules, Swascolin Cough Syrup, which contains Talisari Churna and Tankana Basma, and AA Capsules, which contains Swasananda Rasa. Now, having said this, I would like to open up the floor for any questions that you may have, so that we can have a fruitful discussion about this.
Right, sir. Thank you so much for this very informative presentation, and we have lots of questions. And I request all the doctors and students who are listening to us, first, please start posting your questions. Second, we are getting several questions that how to get these medicines. I think these medicines and products are not readily available across India. So maybe you can type your name, city, and mobile number or email ID, so that we can ask that concerned team and concerned person to be in touch with you. आप कहीं पे भी अपनी किसी सिटी में कनेक्ट होना चाह रहे हैं कंपनी के साथ डायरेक्टली, तो आप अपना नाम, मोबाइल नंबर और ईमेल आईडी या सिटी मेंशन कर दें कमेंट्स में. वी विल आस्क द टीम टू कनेक्ट विद यू, एंड आपके कोई भी क्वेश्चंस है, यू कैन नाउ पोस्ट दैट एज वेल. And I can say that yes, I have already, in our clinic, we are already using Pyral DS, that is Utasini Rus, and Kabasuli Kudnir as well. So I think both are excellent products, and there are several other questions Dr. Jammi said people want to know. So let me just put one by one on your screen, and we can start answering the questions as well. And thank you so much again for joining us. We have Mr. Madhusudan as well. Good evening, Mr. Madhusudan, and thank you so much all the doctors for joining us as well.
Good evening.
So there is one question: are these medicines available in Pune, Maharashtra, from Dr. Rupa?
We can see, Dr. Rupa, we can make these tablets, I mean, this entire treatment available anywhere in India. All you have to do is, I will share my number on the screen in the next few minutes. We can have it shipped to you. Do not worry about the availability. We have a very good logistics partner. We can ship it anywhere across the country. So email address is pranayam@gmail.com. I will make sure that our person gets connected with you. Somebody else has asked whether Swascolin cough syrup can be used for children. Absolutely, it can be used in children. Should not be any reason to not have it. The only place where we don't recommend using Swascolin is in pregnant ladies. And again, we want to do this as a matter of abundant caution, because it has got Kumari Swarasa in it, aloe vera. And in general, what they say is Kumari Swarasa is contraindicated in pregnant women, which is why. Can we give AA caps and Swascolin syrup to children or infant? Absolutely. The dose has to be much smaller. For an infant, it is half a capsule along with half a spoon of AA caps mixed together, and you can give it to them. Dr. Piyush, is there a way in which all of these emails can be saved, so that I can have our person communicate with them and we can send them this information at the earliest?
Yes, don't worry. Our system is already saving that. We will be sending to you as well. Don't worry.
Okay.
In fact, can we go back to the previous one? There was one person asking for pain relief in the ribs, that is intracostal muscles.
Somebody was asking.
Coughing pain.
Pain in the intercostal muscles happens because of the fact that we have an uncontrollable cough. Okay, so what you need to do is you need to have an analgesic along with the cough medicine. So my recommendation is to take the Orthoraksha tablets, which work really well in a very gentle pain relief system. So it works really well along with the Sudarshana Churna capsules and Swascolin AA caps combination. It gives you excellent relief for both of them. So combination remains same for children and adults with variations in weight. Yes, exactly. The combination remains the same. It is just the dosage that changes based upon the weight. We will send you all the details. Our medicines available in Girgaon, Mumbai. We can make it available, sir. We can make all of these medicines available anywhere in India. Oh, as a matter of fact, Dr. Rupa, AA caps can indeed be used along with Swascolin for allergic wheezing. It works excellent. It's a long-term process, because allergy is a hypersensitive reaction to the allergen that's found in the environment. It works really well. And for asthma as well, yeah.
In fact, last time I had shared the entire mailing address and of National Sales Managers.
We will share
Sir,
it
we are
again.
getting several questions. Sorry to interrupt you. We are getting several questions. So once again, maybe you can explain the dosages of all the medicines and all the like products which we have used in COVID management as well as in the cough and also at least once again you can specify regarding the dosage of all the medicines. That will be helpful for all.
Okay, let me share the screen again. I will just just 1 second. Okay, so this is a summary. Basically, Sudarshana, I will go through this very slowly. Now, I'm talking about an average adult. Sudarshana Churna. This is for patients with COVID. Sudarshana Churna capsules, 2 capsules, 3 times a day or 4 times a day, depending upon the fever. I would say if the fever is more than 101 degrees, it is 4 times a day. Kabasura Kudnir Khada. So you take 1 teaspoon of the churna that is there in the packet, then add it to 1 glass of water, bring that down to 1/4. Okay, so that is your dose for an adult. This for a COVID patient has to be taken 2 times a day, early in the morning and early in the evening. Say, I would say 6 o'clock in the morning, 6 o'clock in the evening, for a good benchmark, so you don't forget the timings. Pyral, which is Hutashini Rasa. This for an average adult weighing 60 to 65 kilos, 2 tablets 3 times a day. Anything more than that weight wise, 3 tablets 3 times a day. So I hope this is clear. Let me repeat. Sudarshana Churna capsules based on the fever, anything less than 101 degrees Fahrenheit, 2 capsules 3 times a day. Anything more than 101 degrees Fahrenheit, 2 capsules 4 times a day. Kabasura Kudnir. Make the kada 1 teaspoon in 1 glass of water, brought down to 1/4. Obviously, please filter it so that the the kada churna doesn't come through. Filter it with the tea filter or tea strainer or whatever, and consume it while it's still a little warm. For a COVID patient, 2 times a day. For people in the family and caregivers who don't have COVID, 1 time a day. Pyral, up to 60 to 65 kilos, 2 tablets 3 times a day. Anything more than 65 kilos, 3 tablets 3 times a day. These are very small tablets. These are about 100 mg. So that is all. So you need it. That's the dosage you need to take. Now the 3 products is the cough. For the cough syrup, AA caps and Swascolin syrup, they go together always. For an adult, again an average adult of 60 to 65 kilos, 2 capsules to be opened, the contents poured into a big spoon, 1 capful of Swascolin syrup, mixed together properly and consumed. For a child, let's say it's 30 kilos or 35 kilos, or somebody who's a lightweight, a lady who's sort of 40 kilos, 45, 1 capsule is enough. 1 capsule 3 times a day. For an infant, half a capsule with half a capful of Swascolin syrup mixed together and consumed. Immunzen granules. There is a spoon that is already provided in the packaging. 1 spoon in the morning, 1 spoon in the evening, 1 hour before food. Now, this is the reason why you want to take it before food, because it's an excellent, stimulant for appetizer. It's an appetizer. It makes sure that your digestive juices gets flowing, and you're able to eat properly, and it has all of the micronutrients already provided so that your absorption can happen in a very effective manner, which is why it has to be taken prior to food. I hope there is clarity in the dosages.
In fact, our Kabasura Kudinir, if you see here, the 15 herbs, you can easily, it comes as a mixture, not as a powder like others try to sell it. Many of the people can easily identify all the 15 herbs. That is the reason why Dr. Jammi was telling that after making the kada, you have to strain it. And it gives excellent.
Dr. Rupa, AA caps and Swascolin combination, it's got Swasaranda Rasa. Now, it also has got Tankana Basma and Talisadi Churna. So, all kinds of coughs, this combination works really well. For productive as well as a dry cough, it works really well. Oh, we use this. Besides COVID, Dr. Rupa, we use this in flu. We use this in several infections. As a matter of fact, if you have any strep throat, basically things where you have sore throat, this works really well. So, and any fevers of unknown origin, it works. So somebody is asking, Dr. Sukumar Joshi is asking, explain the cost for a complete course. Like I said, depending upon whether you come in the beginning stage of your disease or the middle stage of your disease, the treatment cost for an entire 15-day course ranges from 2,000 rupees to 4,000 rupees. Maximum 4,000 rupees for 15 days. Prophylaxis of COVID, we give Kabasura Kudineer and Sudarshana Churnam, only these two. Kabasura Kudineer, the Kada, 1 time a day. Sudarshana Churna capsules, 2 capsules, 3 times a day. This is the prophylaxis. Post-COVID, we ask people to take Sudarshana Churna again for about 10 days continuously and Immune Zen indefinitely until the pandemic situation is over. So, Dr. You asked about what kind of cough, even in whooping coughs. Any representative? Absolutely, Dr. Radhika. I will get your contact details from Dr. Piyush, and I will have our persons get in touch with you.
Dr. Radhika, we request you to maybe post your email ID or contact number so that we can connect you with the company, or we have already posted the contact number of Dr. Jammi as well. So any one of you want to connect with them directly, this is the number flashing on the screen. So you can just maybe click and send a message or
WhatsApp number. Feel free to WhatsApp me. I'll be happy to make sure that the medicines are available to you as much as possible. How to manage post-COVID weakness, Dr. Rajinder Kundra. There is Immune Zen works really well in managing post-COVID weakness, along with something called GTP. GTP is a general tonic, which is actually very useful in making sure that this debilitating weakness that is found in many post-COVID patients, especially in the the 50s to 60s age range, it has worked very, very well for them. GTP capsules. Again, the dosage is based on the weight.
We have people in Chennai.
I wanted to tell you about the importance of the minerals in the plants. So we don't really need to take any vitamins or supplements, as long as you know what are the right plants to choose, and that is where our forefathers have been very great in their knowledge sharing with us, and we have been very lucky and very grateful to my grandfather, my great grandfather, my father, for having passed on that knowledge to us. And we hope to do that to the rest of the doctors in India, and hopefully we'll be able to spread this knowledge as much as possible. Dr. Ritika Bharat, you want to know about Huco tablets? Huco is actually a throat lozenge. Basically, what we tell people is we tell people to take 2 tablets of Huco and actually pop it in your mouth and keep it without biting into it. And then just let those juices flow through. So it works very well for coughs of unknown origin as well as sore throats. And obviously, as the name suggests, Huco stands for whooping cough. That's how it was originally started in those days when my great grandfather was around. So that was the origin of the name Huco. Can you please take, after 2 months of COVID positive discharge, please do take it. You can just stick to Sudarshana Churna capsules and Immune Zen. You don't need to take the entire thing. Only those 2 are enough for post-COVID. So Immune Zen is what we highly recommend because it has 19 different herbs. It is processed a certain way. Actually, these are things that are found in various aspects. Now, if you actually just put them together and then mix it and granulate it and eat it, it becomes very bitter. It is actually a very bitter taste. But because of the way my great-grandfather processed it and because of the way he has taught it and handed it down to us, Immune Zen as such is a very tasty formulation. Which has got jaggery as its base. We don't use sugar because jaggery again has got a lot of trace elements that are very, very important for immunity. Contents of GTP capsules, it's got Jasadabasma, it's got Tankanabasma, it's got Gokshara, it's got, I'll try to remember, it's got Pravala Basma, I think it has also got Ashwagandha. Yeah. And two other ingredients that I can't remember at the top of my head, but these are the basic ingredients.
So I think there are many people are still we are getting some questions on our WhatsApp as well. Those who are attending from our website, but we have a limited time and we respect all of you also for joining us a bit late as well. But I think this time is more comfortable and we are getting this feedback. So we'll try to have more and more sessions at an evening slot because
No problem at all.
we can see that much more engagement and much more like audience are there right now. And we request all of you, we already posted contact details of Dr. Jammi, so you can maybe connect with them directly. And quickly, I want to request and I want to maybe have some additional aspects or maybe any tip or anything Dr. Anita want to share in this context which we are discussing today. If you have something to share or maybe Mr. Madhusudan wants to share something supervising the entire activity in the company as a person who is dealing with marketing and maybe the overall operation. So maybe both of you want to add on to something what Dr. Jammi has explained us today, and any quick tip or any other quick point we want to add, you can just please go ahead so that accordingly we can move forward for the conclusion of this session today.
There's just one point I want to make.
Ma'am, you can just unmute yourself. Yes.
Okay, can you hear me?
Yes, we can hear you.
Yeah. Okay. Yeah. Sorry.
Yes.
So one point that I wanted to make here was about our Kabasura Kudini. It has 15 ingredients, and we are probably one of the few brands of Kabasura Kudini which has all the 15 ingredients. And we put in a lot of effort to source really quality ingredients for our Kabasura Kudini. And Pyril, of course, like Dr. Jammi mentioned, is one of our proprietary products. It's been in our company for a long, long time, and it's a really effective medicine for COVID. So this is the point that I wanted to make, Mr. Madhusudan.
Yeah, further adding up. Are you able to hear me?
Yes.
Yes, please.
As I showed you the display, particularly in the Kabasura Kudini, the packet, you will find all the 15 ingredients independently. You can pick it out with the hand. It is not like somebody has made a powder of something and given it to you. And that is the reason why Jammi's Kabasura Kudini has an excellent listing, particularly in the respiratory tract conditions in COVID, which is where it is. And particularly, we have a lot of sales personnel, particularly in South India. We can definitely reach you out, provided we get your number and address. In Chennai, as Dr. Radhika Mani was asking, we have our own field staff. We can immediately reach you out. And most of our products, as Dr. Jammi told, we can definitely ensure that it reaches you from the date of your visit, within 72 hours, you will definitely receive even the farthest part of the country.
Dr. Piyush, there are a couple of people who want to connect on YouTube. They want to connect with the company from Delhi and also in Pune. So if you can figure out a way to give us this information, we will make it our business to do only this tomorrow, so that all of these people have the ability to treat patients with COVID and without having to worry too much about too many things in terms of their availability, in terms of medicine availability or reaching out. All technical knowledge will be shared with them, all the technical information along with the logistic support we will extend to them, not a problem at all.
Sure, thank you so much. And I think many of the doctors are asking, we can have a structure, and the model is directly you can connect with the company. We are already doing that, and in that way the company can pass on the maximum discounts to you as well. And they are very quick and prompt in terms of the dispatch. So within few days, within couple of days, sometimes 2 to 3 days, you will get the products as well. So I request all of you to quickly get in touch. We have already shared the contact number, email ID, and there is Dr. Singh is requesting that she has joined late. So you want a summary. So I request you can go to the video again. Already couple of times Dr. Jammi has explained the summary of the protocol. So what you can do is after this session, the entire video will be available on our YouTube channel as well as on our Facebook page. So you can go and check and like do a rewind, and you will get the detailed information available there. There are a couple of more questions. Let me just quickly take that as well, and then we will conclude the session. And prior to that, I want to add on to the entire discussion. I want to add one very important point for all of you. See, what happens is in Ayurveda, as Dr. Jammi mentioned, all of you, maybe many of you are already listening to us. You have your own experience, and you must be doing various treatments. And it's not about, by the way, COVID. It's not about this particular indication. In general, I want to emphasize I'm not using that much, to be very honest, but yes, I'm using quite a few products and medicines now from Jammi Pharmaceuticals. I want to add one more aspect to it. The entire thing is, see, what happens is in Ayurveda, sometimes we have seen definitely Ayurveda is quite effective, but due to certain classical process or classical ways, I will say, or certain products, sometimes the products are a bit more like in terms of the prescription. See, the mindset of the patient is we have to replace one or two tablets with one or two tablets in Ayurveda, or one or two maybe capsules, syrups, or whatever he or she is taking. They don't want to get too much of medicines sometimes. So in many medicines and many products, I have seen specifically in Jammi that we can replace that. Like for example, we are just using Pyrrol DS right now, and with that only we can see very good results. Yes, we have maybe one or two other medicines from other companies, but overall I can say, like for example, the same is for the Cystavit, for the same is for their Orthoraksha, in many cases of arthritis. So sometimes we were struggling, and in our protocols, in terms of having multiple medicines or multiple aspects has to be there with each formulation. So the best part which I have realized is they have this specific polyherbal formulations in their own proprietary or patent formulations, which we can easily, with one or two single or maybe two or three medicines sometimes, we can easily manage the entire case, because sometimes patients are not that much adaptive that they will take 5 or 10. I've seen, in fact, sometimes I've seen 15 to 20 medicines in an Ayurveda prescription, which they are not comfortable, or in the challenge of an private practice of Ayurveda, that is a bit challenging thing. So I'm not able to control the questions now. So let me just free flow some more, and if Dr. Jammi has that time, so maybe we can
No,
get some
happy
more.
to, please. Happy to.
So this we have already discussed. So yeah, so there is one more question regarding the side effects. Is there any
Yeah.
side effect, like for Kalas? We have seen that there are some side effects of gastric irritation and
Dr.
also maybe.
Isha Garik, now the side effects of Kabasara could be like gastric irritation. We have had people report it. Yeah, this is true, but it happens in about 5% of the population. Now, this is what I tell them. See, it's either that or COVID. You take your choice. So the gastric irritation can be easily dealt with, not a problem. There are enough ways in which you can deal with the gastric irritation. My point is, you always weigh the risk versus benefit ratio for any medicine. And in Kabasara Kudnir, when I take it, I have no problem with it. But when my brother takes it, he has constipation. So it depends from individual to individual. So like I said, sometimes you may have gastric irritation, sometimes you may not. But in 5% of the population, we have seen that there is some sort of a gastric problem associated with it. And in that case, we just say deal with it, because for you right now to prevent COVID is a lot more important than having the gastric problem. What about coagulopathy in COVID? Dr. Rupa, that happens in a much more severe case of COVID. When you're dealing with mild and moderate cases, that never has happened. I think you need to get into a ventilator. I mean, on oxygen support. Ventilator is not necessary, but oxygen support. If oxygen level falls below 95, that's something that has been constantly advised. So please go ahead and get an oxygen. You don't have to go to a hospital. You can get it done at home itself. It's not a problem. But if you come at an early stage, it will never fall below 95.
And I also request, on the same question, I also request all the doctors who are listening to us right now. We did a session last week regarding the ICU treatment and ICU management of Ayurveda interventions along with the allopathic. So there is one doctor from Gujarat. He's doing that, and you can go to that video and see. He has beautifully mentioned several medicines also and several treatment protocols as well. So you can go and watch that session in our previous sessions. You can see that it's a nice, interesting session and interesting, you can say, webinar to attend. And one more aspect, see, the key is which we are seeing in our practice. The key is as soon as possible. If you right now, like we are in our local area, we are a bit like propagated that we are treating COVID. So any person who is getting a report positive, the same day they are calling us and they are asking for the medicine. So the key is as soon as the person identified as COVID positive, you should start the interventions. Do not delay. In fact, some people are having that perception that many saying that okay, they want to take allopathic. So we say okay, no problem. Along with allopathic, at least start Ayurveda. So don't delay in starting Ayurveda. That is the key. So if as soon as possible you are able to start, you will be getting the effects and getting the reports negative as soon as possible. But if you delay for say few days, then maybe in some cases we have seen the things are getting to the emergency medicine and that kind of stuff, and complications are there, and damage also there. So but Ayurveda medicines and Ayurveda interventions are doing, they are decreasing the viral load with a very significant pace. So that we need to understand, and in fact for prophylaxis also there are so many interventions. But specifically again, I in fact it's not about, by the way, I think we have started Pyral DS prior to COVID also. Any kind of fever, any kind of pyrexia, any kind of maybe antiviral or any fever, it's an excellent product. I appreciate you people for this, and because we
Thank
are
you.
using exhaustively. And in fact, personally, I also I think got maybe 2 or 3 episodes in last 1 year, and every time I've just taken your Pyral DS maybe for 1 or 2 days, not more than that, with honey. So it's like, by the way, I just want to mention, so it's better if you crush these. These are very a bit soft, so you can crush that 2 tablets and mix it with honey and take. I think it is very effective, and within 1 or 2 doses, I have seen a reduction of this temperature by 2 to 3 degrees. So thank you again for maintaining this quality and this efficacy, which is very much required, and I can say it will work better than paracetamol sometimes. Correct me if I'm wrong.
Oh, it does. It does. It actually does.
Great. So thanks so much.
I will have
I
to tell
think
you something.
yeah.
Personal experience. I had gone to Bangladesh in early February, and I came back with a very bad dry cough. I'm pretty sure that I had COVID at that point in time. Although at that point in time, India had not had got COVID, but I had a very bad cough. I thought I have generally you get a cough. I generally take AA caps and Swascolin, but this was a different kind of a cough, and I started having that pain. I just ignored it. Like cough, chale jayega, no problem. But I generally didn't take it. Then when I started having that one day continuously, I had that persistent cough. That's when I started taking the Swascolin AA caps Pyral combo, and I was fine in about 3 to 4 days time. I probably had COVID. I didn't know. I don't know. But I guess because I had gone abroad at that point in time and I'd gone for a conference, and there were a lot of Chinese people, there were a lot of Nepalis, there were a lot of Vietnamese, Cambodians. Various people were there, and I'm pretty sure I was exposed to it, and I just didn't know it was COVID at that point in time because it was still early days and people hadn't really gotten to the point where people were very careful about it.
In fact,
Mr.
Dr. Jammi, in fact, Dr. Jammi and Dr. Anika have been on a prophylactic course, and me also, I'll say from the month of July. We have been on a prophylactic course of Sudarshana Churna capsules, and that has really boosted our immunity. We can definitely share that information.
Actually, we were open throughout the lockdown period because we are an essential service, manufacturing of essential services. The government had allowed us, the Tamil Nadu government had allowed us. Right from March, actually, it was just Dr. Anita and I who had gone to buy all the raw materials from all the places. We had met so many different people. Touchwood, we had not fallen sick even once because we were constantly taking Kabasura Kudineer Kada and Sudarshana Churna capsules, and we never did have to worry about having to fall sick. Even though it was in the back of the mind, we didn't have to worry because we were constantly protected by this.
Great, and I think today I have just realized we are it's not a good thing to celebrate, but today is the anniversary. On last year, the same date, the first patient of COVID was identified. It's 17th
Is it
November.
right? Okay.
So it's a coincidence that we are doing this
In-
webinar today. But
Wuhan.
exact 1 year we have completed of yeah.
Okay.
In Wuhan. And regarding
interesting.
your suggestion of using honey for viral disease, I remember when his grandfathers or everybody practicing, particularly for young infants, they used to advise to take this Pitasina rasa mixed with mother's milk itself. They used to mix it in mother's milk and feed to the child. Take it in a spoon or in that particular kindi, mix it with the mother's breast milk and feed the child. It used to have dramatic results.
Dr. Nish Singh has posted a very interesting question. I think I want to address that. It's a very important, interesting question. So, question is, in some COVID patients, they report a headache, especially people with a history of migraine. What can we do in such a scenario? Now, the biochemical basis for migraine is as follows. You get a migraine when you have faulty serotonin metabolism. Okay. Now, yes, it is very possible that COVID patients report a headache. People with a migraine. The reason this happens is because when you are having a fever, you don't eat properly, you're affected with COVID, your liver gets affected. Now, the seat for serotonin metabolism is the liver, right? And again, there are extensive studies that have shown that if your serotonin metabolism has been impacted, then you end up with very severe attacks of migraine. What we recommend in such patients is we treat them with Livercure Complex Forte, which is of course the oldest liver medicine in India. It's been around since 1897, and that works really well for people with migraine headaches. I hope that answers your question.
In fact, we are coming out of the exclusive preparation for migraines, as I had actually exhibited the other day. Migricare, we are coming out of it.
Great, sir. Thank you so much. And I think we all will be looking forward. And I again thank all the doctors for joining us today. I thank our panelists, Dr. Jammi, Dr. Anita, and Mr. Madhusudan also. And it was a great session. I request all of you who have joined late, please go back and see the entire session. The treatment protocols are there. And in the last, I want to again emphasize the quality of the medicines of this particular company, that is Jammi Pharmaceuticals, is excellent. I can personally vouch that because we are using in our clinic and we are getting very good results. So, we have already shared the details with all of you, so you can connect with them directly and they will pass on whatever the maximum discount. I should want to clarify that indianvaidyas.com is just connecting you with all these companies. We are not having that commission model. We don't charge that. We don't follow that policy in our organization. So you can directly deal with them. You can directly do whatever the business you want to do. And one thing we can vouch is you will always see good results in all your patients. So I think the last question, there are many questions which I have surpassed in our messages, but let's have this last question of the day and we will conclude the session.
In comorbid patients, clotting of blood, is there any treatment? I think you need to hospitalize them immediately because you need to give them blood thinners. Make sure that they're doing this. So let us be very clear. Allopathy has its place for emergency care. We don't want to throw the baby out with the bathwater. That's not correct. It's not the right attitude also. So when you reach that stage where you have tremendous clotting of blood, then you need to immediately give him emergency care. Once he gets out of it, we can fix him with Ayurveda. But as such, for COVID, Ayurveda has excellent cures and allopathy does not have. We are seeing this on a daily basis.
Yeah, because see, the key is do not delay. The key is I request again to all of you, do not delay in terms of starting prophylactic. Oh, we are having good diet, we are healthy. Why do we need any prophylactic? Why do we need any herbal thing? Don't have that mindset. You never know, this virus can affect any one of us in any capacity. We are young. It's not that we can't go to an ICU getting affected by COVID, but the point is that as soon as possible, we are having some prophylactic aspects with us. You like kala, you can take kala. You like tablets, you can take tablets. You can take any other thing as well. For the sake, you can take any kind of a chavanprash or whatever you want to do. But have something prophylactic. In fact, many allopathy doctors are already taking these prophylactics with due respect to whatever the professional issues we all have. But many of them I have personally know, and in fact I have personally sent to them, dispatched to them as well. So we respect, and absolutely I agree with Dr. Jammeed. For emergency medicine, for any kind of surgical interventions, definitely we have to look forward as far as the allopathic system of medicine is concerned. But yes, for the lifestyle disorders, for certain chronic ailments, and for specifically if we talk about COVID, the sooner we start, the probability of getting admitted to an ICU will be delayed. So that is the key. And just inform to all the patients and all the, in fact we keep on informing whosoever is visiting our clinic for any issue, that we have already healed so many cases, and you just need to keep this in mind, that have some prophylactic for all your family, entire family members, and as soon as someone will get positive, ask them to start immediately, so that it will ensure that they are getting healed and getting cured as soon as possible. And till now, whatever the patients we have treated, nobody has gone to any emergency or ICU kind of situation, because they all have started early. So that is the key which I want to convey to all of you. And we again thank to our panelists today. And it was an excellent session. We have not realized that we are sitting on the first year completion of COVID-19. Last year on the same date, the first case was being diagnosed. So it's a great coincidence. It's not great to celebrate this kind of anniversary. We all don't want to celebrate these kind of anniversaries, but yes, it has to also being conveyed. And now WHO has also decided to establish their traditional medicine overall, I will say, the infrastructure and the entire thing to India, because they also believe in some extent that India has a great culture. It's about Ayurveda, it's about Siddha, it's about any other system of medicines. Tribal medicines are there. So many medicines are there with certain states and certain cultures, and Ayurveda being one of the oldest. So we need to again take it forward. We all who are listening right now, either doctors, students, or the followers of Ayurveda, I request all of you to have authentic, genuine practice, and you will get patients as a byproduct. That we bet, and we are very much sure. And I again thank to this company, Jammi Pharmaceuticals. We are again, I repeat, I don't appreciate this much to any company, but they are really doing good job in terms of maintaining the quality. There is no product till now I have gone through in which we are not satisfied in terms of the quality is concerned. We will be coming up with many more exciting products and treatments in future, every week, every Tuesday. And I think this time is best, so we can have maybe evening time. We will internally discuss again, and we will finalize one slot for all of you, so that all of you can join as per your comfort, as per your availability. Do share your feedback. What time will be suitable for you? Will it be afternoon, or will it be this time? We have just done one event in this time as well. So whatever the time is suitable for maximum of you, we will have a fixed slot every evening or every afternoon on Tuesday. We will be coming up with the team, and we will be also getting associated and inviting certain other doctors who are using certain medicines from Jammi Pharmaceuticals to give us more insight about their treatment protocols and their experiences and case studies maybe. Thank you so much again to all of you. Thank you for joining us today. Have a great week ahead. Thanks.
Thank you.
Thank you very much. Good night.